When a patient receives a high blood pressure diagnosis, the immediate, universal medical prescription is simple: drop the salt. Patients naturally follow orders. They clear out their pantries and pivot their daily meals toward processed foods, aggressively marketed as low sodium. But removing salt destroys a product's flavor profile. To keep these foods palatable on store shelves, manufacturers quietly replace that missing sodium with heavy doses of hidden sugars and corn syrup. By strictly adhering to their new diet, patients successfully avoid a few milligrams of sodium, but they inadvertently consume a massive, concentrated load of sugar in the process. That hidden sugar initiates a chain reaction inside the body that directly elevates blood pressure. The prescribed cure actively drives the disease. An influx of hidden dietary sugar triggers the immediate release of a specific hormone, insulin. When the sugar intake is constant, insulin spikes and stays elevated. This animated diagram illustrates that biological shift. The needle surges into the red and locks in place, creating a state known as hyperinsulinemia, chronically high insulin. This is the true underlying antagonist of the cardiovascular system. High insulin targets the body's primary fluid filtration system, the kidneys. The hormone sends a faulty biological signal, commanding the kidneys to stop excreting sodium and force it back into the bloodstream. Trapped sodium acts as a chemical magnet. It pulls in and holds on to excess water, severely bloating the surrounding tissue. All of that retained water directly increases the total volume of blood flowing through the circulatory system. Hyperinsulinemia turns the human body into a closed, overflowing hydraulic system. Pushing a much larger volume of liquid through the same space generates intense physical pressure against the artery walls. The excess fluid volume is only the first failure point. We have to look at the physical infrastructure of the vessel walls themselves. This animated cross-section shows the endothelium, the inner lining of the blood vessels. Normally, it pulses and flexes to accommodate blood flow, but chronic insulin bombardment triggers severe inflammation along this lining. The resulting structural damage is called endothelial dysfunction. The flexible tissue hardens, transforming elastic pipes into stiff, rigid tunnels. The biological danger compounds. The body is now forcing a dangerously high volume of fluid from the kidneys through newly tightened, inflexible spaces. Finally, insulin bypasses the plumbing entirely to manipulate the pump driving the system, the heart. Sharp insulin spikes trip the sympathetic nervous system, falsely sounding the body's neurological fight-or-flight alarm. This chemical alarm forces the already stiff blood vessels to constrict even tighter, while artificially accelerating the heart rate. The cardiovascular system enters a state of closed-loop failure. High insulin swells the fluid volume, calcifies the pipes, and kicks the pump into overdrive all at once. Bring this biology back to the grocery store aisle and the well-intentioned purchase of a low-sodium meal. The hidden sugars in that processed food spike the patient's insulin. That insulin forces their kidneys to stubbornly retain whatever trace amounts of salt they actually did consume. By adhering to outdated advice, the patient's own strict dietary discipline is biologically weaponized against them. To escape this cycle, the approach to cardiovascular health requires a hard pivot. Patients must stop obsessing exclusively over sodium labels and begin aggressively auditing their food for added sugars. Achieving healthy physical pressure inside the arteries is impossible until we first lower the metabolic pressure of insulin in the blood.